The fluorescent lights hum above worn linoleum floors at Beth Israel Medical Center in Newark. 3:47 in the morning, and the supply closet smells like bleach mixed with old cardboard that has absorbed years of antiseptic and anxiety. Dr. Maya Reyes counts suture kits. Her fingers move in precise rhythm. 12 boxes, 4 missing inventory tags. She logs each item on a tablet older than her residency. Count, stack, log, repeat. She is 34 years old. The overhead lighting makes her look older, carving shadows beneath her eyes that sleep has not visited in weeks. Behind her, voices drift from the break room down the hall. The walls here are thin enough to carry conversations that were never meant to be private. Dr. Castellano's voice cuts through first, smooth and confident in the way of men who have never doubted their place in the hierarchy. She's been here 6 months, and they still have her doing stock counts. Dr. Patel responds, quieter but equally dismissive. Maybe that's all she can handle. Small hospital experience, right? Rural clinic somewhere out west. Montana, I think, or Wyoming. One of those places. Maya does not turn toward the sound. Her jaw tightens once, a brief compression of muscle and bone, then releases. Her hands do not pause in their work. She logs the inventory with a pen that does not belong in a supply closet. Military-grade construction. Pressurized ink cartridge. It writes underwater, upside down, in conditions that would destroy ordinary instruments. No one has ever asked why a woman who counts bandages carries a pen built for war. The emergency department at 4:12 in the morning exists in that strange space between night and dawn, where time feels suspended. Maya restocks a crash cart, checking ampules of epinephrine and atropine, ensuring IV start kits are complete. The ambulance bay doors explode inward. A paramedic rushes through, hands pressed against a chest wound, his voice tight with controlled panic. GSW to the chest, blood pressure 70/40 and dropping, patients crashing. The trauma team mobilizes with practiced speed. Dr. Castellano leads, moving fast and decisive. Nurses swarm, monitors beep to life. Maya steps back against the wall. She watches. Castellano's hands work quickly, calling orders in rapid succession. Get me a chest tube tray. Someone page surgery now. The patient on the gurney has blue lips. His chest rises unevenly, one side lagging behind the other, in a pattern Maya recognizes before her conscious mind forms the words. Left side, paradoxical movement, tension pneumothorax. Castellano reaches for the 5th intercostal space. Standard teaching, textbook placement. The monitor alarm screams. Pressure drops to 60/30. Maya's hand moves toward her pocket, fingers brushing the edge of the crash cart. Then stops. She turns back to her restocking, counts IV catheters, logs nothing. 30 seconds pass. Castellano corrects his approach, moving the needle higher. 2nd intercostal space, mid-clavicular line. Air hisses out under pressure. The sound is immediate and unmistakable. The patient's pressure begins climbing. 70, 80, 90. Dr. Patel exhales in relief. Nice save. Castellano strips off his gloves. Satisfaction evident in the set of his shoulders. Just needed a second to reassess the landmarks. Maya wipes down the crash cart with methodical precision. She says nothing. Her face reveals nothing. The pen in her pocket catches light as she moves. Black titanium, worn grit polished smooth by years of use. On the clip, barely visible unless you know to look, an engraving reads, NCIS JSOC 17. The break room at 6:30 smells like burned coffee. Maya sits alone at a corner table with a protein bar she's not eating and black coffee with no sugar. Her phone buzzes against the laminate surface. A news alert illuminates the screen. USS Gerald R. Ford completes deployment. Carrier strike group returns to Norfolk. She stares at the words, does not blink, does not scroll, just stares. The world around her fades into background noise, the hum of the refrigerator, distant conversations, the squeak of shoes on linoleum, all of it receding until there is only the screen and the words and the memory that rises unbidden. Rolling deck beneath her feet, red emergency lighting, alarms screaming through metal corridors. Her hands wrist-deep in blood that is not hers. A young sailor's face, 20 years old, eyes wide with fear that he is trying desperately to hide. She hears her own voice, steady and calm. Stay with me, stay with me. The carrier shudders. Somewhere deep in the hull, An explosion sends vibrations through steel. She keeps cutting, keeps clamping, keeps breathing for him when his lungs cannot. Metal groans under stress. Someone shouts her rank through the smoke. The coffee cup is cold in her hand. Nurse Linda enters the break room, her kind face creased with concern. "You okay, hun?" Maya blinks. The present reasserts itself in layers. She nods. "Yeah, just tired." Linda's eyes drop to the phone screen, to the image of the carrier cutting through blue water. "You military?" The answer comes too quickly. "No." Linda studies her for a moment. The way Maya sits, spine straight even in exhaustion. The way she holds the coffee cup with 3 fingers, thumb anchored for stability. The grip of someone accustomed to keeping hold of things when the ground moves beneath them. "My brother was Navy," Linda says softly. "You just remind me of him sometimes." Maya forces a smile that does not reach her eyes. "I get that." She stands, disposing of the cup with efficient movements, and walks out. Linda watches her go. Something in the gait, something in the economy of motion. Something she cannot quite name, but recognizes all the same. The emergency department at 11 in the morning exists in controlled chaos. Maya stands in the hallway outside Trauma Bay 2, restocking glove dispensers with mechanical precision. Through the window, she watches Dr. Castellano manage a difficult intubation. His hands are steady. His technique is sound. He is a good doctor by any reasonable measure. She moves to the next dispenser. Her phone buzzes in her pocket. She ignores it. It buzzes again. She pulls it out, glancing at the screen. A text from an unknown number. "We know where you are." Her hand tightens around the phone. She deletes the message without responding. Across the hall, a man in his early 60s stands near the vending machines, khaki jacket, graying temples. He watches her with the kind of attention that speaks of recognition. Recognition. Maya feels his gaze, does not acknowledge it. She finishes restocking and walks toward the supply room, her pace unchanged, her expression neutral. The man does not follow, not yet. In the supply room, Maya closes the door and leans against it. Her breathing is controlled but deliberate. 4 counts in, hold, 6 counts out. The smell of cardboard and disinfectant grounds her in the present, but the past is always closer than she wants it to be. She remembers heat, unbearable heat that turned the air thick and hard to breathe. The medical bay aboard the USS Gerald R. Ford. 3 decks below a propulsion fire that filled corridors with smoke and fear. 60 casualties. No evacuation route. She had worked in 130-degree temperatures, her surgical mask soaked with sweat, her hands cramping from dehydration, but never shaking. Never shaking. A young sailor on her table. Petty Officer 2nd Class Daniel Okonkwo, 22 years old. Shrapnel had torn through his femoral artery. She had clamped, sutured, transfused. His eyes had stayed on her face the entire time, trusting her with faith she did not deserve. "You're gonna be okay," she had told him. "Stay with me." He had tried. God, he had tried. But the blood kept coming, and the heat kept rising. And there were 59 others who needed her hands. She had held his hand as his pulse faded beneath her fingers. 22 years old, from Houston. He had wanted to be a teacher. Maya opens her eyes. The supply room is cool and quiet. She pushes off the door and returns to work. Outside, the man in the khaki jacket makes a phone call. "Yeah, it's her," he says quietly. "No, I'm certain. I just watched her assess a tension pneumo through a window from 30 feet away. Her eyes didn't leave the patient's chest wall. Understood. I'll make contact." He ends the call and waits. At 1:15, Maya takes her lunch break in the hospital cafeteria. A salad she does not eat. Water she sips without tasting. Her hands rest on the table, fingers laced together. They are still steady. The man approaches from behind. His footsteps are measured, deliberate, the gait of someone who's spent decades on rolling decks. "I thought that was you." Maya freezes, does not turn. But I told myself no, no way, not here, not stocking shelves in Newark. Every muscle in her body goes taut. She closes her eyes briefly, then opens them and turns in her seat. Commander William Hatch, retired, stands 3 feet away. He is 62 now, lines deeper around his eyes than she remembers, but the clarity in his gaze is unchanged. "You're mistaken," she says quietly. I watched you hold a kid's aorta together with your fingers for 40 minutes while we waited for a medevac helo that couldn't land. You told him a joke about a penguin. He laughed even though he was dying. He lived because you wouldn't let him go. Her throat constricts. I don't know what you're talking about. Lieutenant Commander Maya Reyes, service number 381-774021. Trauma surgeon, USS Gerald R. Ford. You saved 54 lives during the propulsion fire. People at nearby tables begin to notice. Conversations quiet. Eyes turn toward them. Maya stands. Commander, please. Why the hell are you counting bandages in New Jersey? I'm not that person anymore. You just identified a bilateral tension pneumothorax yesterday from across a room and intervened when a senior physician missed it. You're exactly that person. She moves toward the exit. He does not follow, but his voice carries. The Navy's looking for you, Maya. She stops, does not turn around. They need you. I'm done saving people who run toward explosions, she says without looking back. Then why did you just do it again? She walks out. Behind her, the cafeteria hums with whispers. Lieutenant Commander? Navy surgeon? The woman who counts supplies? Maya makes it to the stairwell before her hands start shaking. She grips the railing, knuckles white, and forces air into her lungs. 4 counts in. Hold. 6 counts out. She sees their faces in the dim concrete space. All 6 of them. Daniel Okonkwo, Maria Vasquez, Tariq Williams, Grace Lewiston, Jake Rennick, Samuel Cho. Young, afraid, trusting her. She had not been enough. In her pocket. Her phone buzzes again. Another text from the unknown number. Tomorrow, 0800. You don't get to hide anymore. She deletes it, climbs the stairs, returns to the supply closet, counts suture kits with hands that have stopped shaking because she has willed them to stop, because control is the only thing she has left, because if she lets go for even a moment, she will shatter into pieces too small to ever put back together. Outside the hospital, Commander Hatch sits in his car and makes another call. Contact made. She's resistant. No, she won't come willingly. Understood. Send the file. I'll be ready. He ends the call and watches the hospital entrance. Waiting. The emergency department scanner crackles at 3:47 in the afternoon. The charge nurse listens, and her face goes pale. Multiple vehicle MVA on Route 1. Mass casualty event. 10 victims inbound. ETA 4 minutes. Dr. Castellano looks up from a chart. How many critical? At least 6, maybe more. Call University Hospital. See if they can take overflow. Dr. Patel is already on the phone. He listens, then shakes his head. They're on diversion. Full capacity. Castellano's jaw tightens. Then we handle what we can. Clear bays 1 through 4. Get respiratory down here. Someone page anesthesia. The staff mobilizes, but there is fear in their movements. Beth Israel is not a trauma center. They are not equipped for this. Maya stands near the supply station. She hears everything. Her hands continue organizing IV start kits, but her eyes track the preparations. She counts personnel, assesses resources, calculates capacity. They are going to drown. The ambulance bay doors explode open. Gurneys flood through in rapid succession. A woman in her 20s, face covered in blood, glass embedded in her chest and arms. A man, mid-40s, femur bent at an unnatural angle. Screaming. A teenage boy, silent and pale, chest moving in shallow gasps. Paramedics shout over each other. Flail chest, possible pneumothorax, closed head injury, GCS of 9. This one's coding, no pulse, starting compressions. Castellano tries to establish control. Bay 1, take the flail chest. Bay 2, get the head injury. But there are too many. Too fast. The system is collapsing in real time. Dr. Patel grabs the woman with glass injuries. But her pressure is bottoming out. I can't get a line. Veins are collapsed. A nurse struggles with the coding patient. He's in VFib. Someone get the defibrillator. The teenage boy stops breathing. Castellano spins, trying to be in 3 places at once. Bag him. Someone bag him. No one moves fast enough. Maya sets down the IV kit. She walks into the center of the emergency department. Stop. The word is quiet. No one hears it over the chaos. Stop. The room goes silent. Every head turns. Maya stands in the center of the storm, her voice calm and absolute. You, she points to Patel. Take the flail chest to Bay 1. Needle decompression first, left side, then right. Then chest tube. You. She points to a resident frozen near the door. Femur fracture goes to X-ray after you apply a traction splint, not before. You. She points to Castellano. The coding patient comes with me. Now. Castellano stares at her. Who do you think? I think you have 7 minutes before you lose 3 of them. So move. The force in her voice is undeniable. It is not loud, it is not angry, it is command. They move. Maya takes the coding patient into Trauma Bay 3. A nurse follows, wide-eyed. 2 large-bore IVs, 18 gauge, type O negative, push 1 liter wide open. Get me a chest tray and a cric kit. Doctor, we don't have. Then improvise. Use the thoracotomy kit from the OR. Move. The nurse runs. Maya begins compressions. 30 beats, hard and fast, her body weight driving down with mechanical precision. She tilts the patient's head, checks airway. Clear, palpates the neck. Tracheal deviation. Distended jugular veins. Bilateral tension pneumothorax. She grabs a 14-gauge needle from the crash cart. No hesitation. Second intercostal space, mid-clavicular line. Left side first. The needle punctures skin, muscle, pleura. Air hisses out under pressure, violent and immediate. She moves to the right side, repeats the procedure. More air escapes. The monitor, which has been flatlining, stutters. A blip, another. Then rhythm. Sinus tachycardia. Weak, but present. The nurse returns with the chest tray, breathless. I got it. Start 2 chest tubes. 5th intercostal, mid-axillary line. I'll talk you through it. Doctor, I've never. You're about to. Maya's hands guide the nurses. Incision here, blunt dissection. Heel for the rib, go over the top, not under. There. Now insert the tube. Push until you feel resistance. A tube slides in. Bubbles appear in the collection chamber. Good. Now the other side. They work together. The nurse's hands shake. Maya's do not. Within 3 minutes, both tubes are placed. The patient's oxygen saturation climbs. 74, 81, 93. Maya steps back. Strips off gloves stained with blood that is not hers. He'll need a CT. Possible pulmonary contusions. Watch for subcutaneous emphysema. She walks out of the bay. In the hallway, the chaos has transformed into order. Each patient is being managed. The system is functioning. Dr. Patel emerges from Bay 1. His patient is stable, chest tubes in place, breathing regulated. The femofracture is splinted and headed to imaging. The head injury is intubated and awaiting transfer. No one has died. Castellano stands in the center of the department. NT, staring at Maya. She walks past him toward the supply closet. Wait. She stops, does not turn. Who are you? Maya looks back over her shoulder. Her face is unreadable. Someone who's seen worse. She disappears into the hallway. Castellano looks at Patel. Patel looks at the charge nurse. The charge nurse looks at the patients. All alive, all stable. What just happened? Patel whispers. No one has an answer. Outside, in the parking lot, Commander Hatch sits in his car. He watched the ambulances arrive. Watched the chaos. He knows what is coming. His phone rings. Yes, sir. It's confirmed. She just ran a mass casualty event like she was back on the carrier. No, sir. She can't hide anymore. Understood. I'll wait for the Admiral. He ends the call, looks toward the hospital, and waits. The hospital cafeteria at 5 in the evening is half empty. Maya sits alone at a corner table with a salad she has not touched and coffee that has gone cold. Her hands rest flat on the table. They do not shake, not anymore. She controls them the way she controls everything else. Through sheer force of will. Through the discipline that was drilled into her across years of impossible situations. Through the refusal to let her body betray what her mind barely holds together. Around her, normal conversations continue. Someone laughs. A phone rings. Life proceeds as if the world has not just tilted on its axis. She hears footsteps approaching from behind. Measured, deliberate. The gait of someone who has spent decades walking on steel decks. I thought that was you. Every muscle in her body locks. She does not turn. But I told myself, no, no way. Not here, not stocking shelves in Newark. Maya closes her eyes, opens them, turns in her seat. Commander William Hatch stands 5 feet away. He is 62, wearing civilian clothes that do not quite hide the military bearing in his spine. "You're mistaken," she says quietly. "I watched you hold a kid's aorta together with your fingers for 40 minutes while we waited for a medevac helo that couldn't land because of smoke. You told him a joke about a penguin to keep him conscious. He lived." Chris' throat tightens. "I don't know what you're talking about." Lieutenant Commander Maya Reyes, service number 381774021, trauma surgeon, USS Gerald R. Ford, Medical Department. People at nearby tables stop eating. Conversations pause. Eyes turn toward them. Maya stands. "Commander, please. You saved 54 lives during the propulsion fire. Operated for 16 hours straight in conditions that would have killed most people. They called you the miracle of the Ford. You have me confused with someone else." "Do I?" He steps closer, voice dropping but losing none of its intensity. "Because I just watched you run a mass casualty event like you were directing air ops on a carrier deck. I watched you perform bilateral needle decompressions without hesitation and talk a nurse through chest tube placement like you'd done it 1,000 times. I'm a civilian doctor. You're a trauma surgeon with a specialty in combat medicine and shipboard operations. You held the only advanced certification for surgical intervention in extreme environmental conditions in the entire Atlantic Fleet." The cafeteria has gone completely silent now. Maya's jaw tightens. "I left that behind. You can't leave behind what you are. Watch me." She turns to walk away. "They need you, Maya." She stops, does not turn around. "There's an operation, classified, high risk. They need the best trauma surgeon available. Then find someone else. There is no one else, not for this." She keeps walking. Hatch's voice follows her. "A SEAL team operator was injured during a direct action mission in the South China Sea. Catastrophic internal trauma. He's aboard the USS Ronald Reagan, and they're experiencing environmental system failures in the medical bay." Maya steps slow. Heat index is approaching 120 degrees. Smoke contamination from an electrical fire. Limited resources. Sound familiar? She stops completely. "You're the only surgeon alive who's operated successfully under those exact conditions." Maya turns slowly. "You set me up. I gave you a choice. You made it. You saved those people today because you couldn't help yourself. You had no right. A man is going to die if you don't help him. That's the only right that matters." Her hands curl into fists at her sides. "I'm not going back there. You never left." The words land like a physical blow. Hatch takes a step closer, his voice dropping to something almost gentle. "I know what happened on the Ford. I know about the 6 you lost. I know you've been carrying them ever since. You don't know anything. I know Daniel Okonkwo wanted to be a teacher. I know Maria Vasquez had a daughter waiting for her in San Diego. I know Tariq Williams played guitar, and Samuel Cho made terrible coffee that everyone drank anyway because he smiled when he served it." Maya's eyes fill. She does not let the tears fall. "I know you remember every single one of them," Hatch continues. "And I know they wouldn't want you hiding in a supply closet. Don't you dare. They'd want you saving the next one." Her breath catches. Behind them, Dr. Castellano stands in the doorway. Dr. Patel beside him, Nos Linda. A dozen staff members, all listening, all staring. Castellano steps forward slowly. "You're military?" Maya does not answer. "That's why you knew. That's why you moved like." He trails off, processing. "You're not just military. You're special operations medical." "I was," Maya says quietly. Past tense. "Those skills don't expire," Hatch says. "And right now, a 28-year-old sailor is dying because no one else can do what you do." Maya closes her eyes. She sees Daniel's face. 22 years old. Eyes wide with trust she could not fulfill. She sees all 6 of them. "I can't lose anyone else," she whispers. "Then don't," Hatch says simply. Silence fills the cafeteria. Maya opens her eyes, looks at Hatch. "How long does he have?" 4 hours, maybe less. "And if I can't save him?" "Then at least you tried. That's more than he'll get from anyone else." She stares at him for a long moment, then at the staff watching her, then at her own hands, steady despite everything. "Where's the helo?" "Roof, waiting." She nods once, turns to Castellano. The patients from the MVA, they'll need monitoring overnight. The flail chest gets incentive spirometry every hour. The bilateral tension gets a chest x-ray in 6 hours to confirm tube placement. Cement. Castellano nods, speechless. Maya looks at Linda. Thank you for being kind. Linda's eyes fill. Go save him, hun. Maya turns back to Hatch. Let's go. They walk toward the exit together. Behind them, whispers explode into conversation. Lieutenant Commander. USS Gerald R. Ford, 54 lives, the miracle of the Ford. Dr. Patel turns to Castellano. Did we just have a Navy trauma surgeon counting our supplies for 6 months? Castellano stares at the door when Maya disappeared. Yeah, he says quietly. I think we did. The sound reaches them first, deep and rhythmic, cutting through the evening air before the source becomes visible. Thud, 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 rotor wash. Maya and Commander Hatch emerge onto the hospital roof as a Black Hawk helicopter descends onto the helipad. The downdraft flattens everything, sending loose debris skittering across concrete. The side door opens before the skids fully settle. A man steps out, 65 years old, white service uniform, rows of ribbons across his chest that speak of decades at the highest levels of naval medicine. Rear Admiral James Corver, Surgeon General's office. He walks toward them with the confidence of a man who has never been told no. Maya stops 10 feet away. I didn't agree to this. Commander Reyes. Corver's voice carries authority that makes Hatch's seem gentle by comparison. We're wasting time. I'm not a commander anymore. Your resignation was placed under administrative review, pending investigation into the Ford incident. That investigation concluded 4 months ago. You were cleared of all negligence. Your resignation was denied on grounds of critical personnel shortage. You've been on involuntary medical leave. Maya's jaw tightens. You can't just, I didn't. The Secretary of the Navy did. Your leave ends today. This is insane. I have rights. You have orders. Corver steps closer. A SEAL Team 6 operator was catastrophically injured during a classified direct action mission in the South China Sea. He's aboard the USS Ronald Reagan. Ruptured spleen, possible liver laceration, internal hemorrhaging. He needs a splenectomy. Send someone from Walter Reed. They're 12 hours out. He has less than 4. Maya shakes her head. There are other trauma surgeons. Not for this. Corver's voice drops. The Reagan's medical bay is experiencing environmental system failures due to an electrical fire. HVAC is compromised. Current temperature is 124 degrees. Smoke contamination in ventilation. Limited surgical resources. The words hit her like depth charges. You're the only surgeon in the Navy who's successfully operated under those exact conditions. Corver continues. You're the only one who knows how to keep someone alive when everything is trying to kill them. Maya's hands curl into fists. Find someone else. There is no one else. Then he dies. The bluntness of it silences even Corver for a moment. You don't mean that, Hatch says quietly. Don't I? Maya turns on him. You think I want to go back there? You think I want to feel that heat again? Smell that smoke? Watch another kid bleed out because I'm not fast enough? This isn't the Ford. It's exactly the Ford. Her voice cracks. Same heat, same smoke, same impossible situation. And when I fail again, it'll be the same result. Corver steps forward. You didn't fail on the Ford. You saved 54 lives. I lost 6. In conditions that would have killed 60. You performed surgical miracles with minimal resources while the ship was literally on fire around you. I held Daniel Okonkwo's hand while he bled to death because I couldn't clamp his femoral artery fast enough. 22 years old. He wanted to be a teacher. Her voice is raw now. Maria Vasquez had a 3-year-old daughter. Tariq Williams was getting married in 2 months. I remember all of them. Every single one. That's why you're the best, Corver says. That's why I can't. Silence stretches between them, broken only by the idling rotors. Corver pulls a folder from inside his jacket, opens it, shows her a photograph. A young man, late 20s, dark hair, unconscious on a gurney, his skin pale, monitors surrounding him. Petty Officer First Class Marcus Webb, 28, from Oregon. His wife just had twins, 3 months ago. He's never met them because he's been deployed. Maya stares at the photo, does not reach for it. He volunteered for a mission that saved 12 hostages. Took shrapnel when the extraction went sideways. He's bleeding internally, and he's running out of time. Why are you showing me this? Because you need to see who you're abandoning. The words are brutal. Intentionally so. Maya's eyes fill. That's not fair. War isn't fair. Medicine isn't fair. And walking away because you're afraid isn't fair to him. I'm not afraid. Then what are you? Broken. The word tears out of her. I'm broken. I can't save everyone. I tried on the Ford and 6 people died anyway. 6 people trusted me, and I failed them. Corver closes the folder. You didn't fail them. You gave them every chance you could. Sometimes, that's not enough. But it's always worth trying. What if I can't do it? What if I get on that carrier and freeze? You won't. How do you know? Because 20 minutes ago, you ran a mass casualty event in a civilian ED like you were commanding a battle station. Because your instinct isn't to run, it's to move toward the crisis. That doesn't go away just because you're scared. Maya closes her eyes. She sees their faces, all 6 of them, and she sees Marcus Webb, 28, twins he's never met. She opens her eyes. If I do this, if I go, I'm doing it my way. No interference. No one second-guessing my calls. Corver nods. Agreed. And when it's done, we talk about my resignation. For real this time. When it's done, you'll have owned that conversation. She takes a breath, looks at Hatch. You set me up. I gave you what you needed to remember who you are. She almost smiles. Almost. Then she turns to Corver. How long to the Reagan? 90 minutes. Then we're wasting time. She walks toward the helicopter. Hatch and Corver follow. As they climb aboard, Maya catches sight of the hospital below. Through the windows, she can see faces pressed against glass. Staff watching. Castellano, Patel, Linda. The door closes. The rotors accelerate. The Black Hawk lifts into the evening sky. Maya buckles in, her hands steady on the harness. Across from her, Corver studies her face. You ready for this? She looks at him. No, but he doesn't have time for me to get ready. The helicopter banks east, toward the ocean, toward a carrier and a man she's never met who needs her to be what she used to be. What she still is, whether she wants to be or not. Through the window, the sun sets over New Jersey. Ahead, darkness rises from the Atlantic. The Black Hawk cuts through darkness over the Atlantic. Inside, the cabin vibrates with rotor noise that makes conversation difficult, but not impossible. Maya sits in silence, staring at nothing. Admiral Corver leans forward, raising his voice above the engines. I read your full file, Commander, not just the official report, the real one. She does not respond. I know you were 3 decks below the fire with no evacuation route. I know the temperature reached 137 degrees in the medical bay. I know you had 60 casualties and a surgical team of 4, and 2 of them passed out from heat exhaustion. What's your point? My point is that what you did shouldn't have been possible. Command estimated 70% casualties. You kept it under 10. I kept it at 6 deaths. That's not under 10. That's 6. Corver studies her face. Tell me about Daniel Okonkwo. Her hands tighten on the harness. Why? Because I want to understand. There's nothing to understand. He had a severed femoral artery. I couldn't clamp it fast enough. He bled out. How long did you work on him? 43 minutes. And the others? Maria Vasquez, tension pneumothorax, complicated by cardiac tamponade. I got the chest tube in, but the pericardium was already filling. No way to evacuate it without cracking the chest, and I had 30 other criticals. Her voice is flat, clinical. The only way she can say these things without breaking. Tariq Williams, blast injuries, perforated bowel, shredded mesentery. I resected what I could, but he went into septic shock. Ensign Grace Lewiston, traumatic brain injury, pupils fixed and dilated by the time she reached me. Jake Rennick, exsanguination from multiple shrapnel wounds. And Samuel Cho, smoke inhalation complicated by chemical burns to the airway. I intubated, but the damage was already done. Silence fills the cabin. You remember every detail, Hatch says quietly. Every single one. Maya finally looks up. I remember what they were wearing, what they said, how their hands felt when they grabbed mine. I remember the exact time each of them died. I carry it every day. Corver leans back. That's the difference between you and most surgeons. What is? Most surgeons compartmentalize. They have to, or they'd never operate again. But you don't compartmentalize. You carry them. And somehow you keep working anyway. I stopped working. I was counting bandages in Newark. You were hiding. There's a difference. But the moment someone needed you, you stepped up, because that's who you are. Maya shakes her head. You don't understand. I can't go through that again. Watching someone die because I'm not good enough. You're the best trauma surgeon in the Navy. Then why couldn't I save them? The question hangs in the air, raw and desperate. Corver's voice gentles. Because medicine isn't magic, Commander. It's skill applied to chaos. Sometimes the chaos wins. That doesn't mean you failed. Tell that to their families. I did. He pulls out his phone, opens a folder, hands it to her. These came through official channels after the Ford investigation closed. Maya stares at the screen. An email. Then another. And another. From Daniel Okonkwo's mother. Thank you for staying with my son. Thank you for not letting him die alone. From Maria Vasquez's husband. You gave her every chance. Our daughter will know her mother was a hero, and that you fought for her. From Tariq Williams' fiancé. He told me about you once, during a video call. He said if anything ever happened, he hoped you'd be there. You were. That means everything. Maya's hands shake as she scrolls. There are more. Letters, messages, gratitude from the families of people she couldn't save. They don't blame you, Corver says. They never did. I blame me. I know. But maybe it's time to stop. She hands the phone back, unable to speak. The helicopter begins its descent. Through the window, lights appear on the black water. The USS Ronald Reagan, massive and illuminated, cutting through the night. 5 minutes. The pilot calls back. Maya closes her eyes. Breathes. 4 counts in. Hold. 6 counts out. When she opens them again, something has shifted in her expression. Not peace, not forgiveness, but resolution. Tell me about Marcus Webb, she says. Corver pulls up a file. Petty Officer First Class. SEAL Team 6. 28 years old. Wife Amanda. Twin daughters Sarah and Emma. Born 3 months ago while he was deployed. He volunteered for a hostage rescue operation in the South China Sea. 12 civilians extracted successfully. Webb took shrapnel during exfil when the transport was hit. Ruptured spleen, possible liver involvement, internal bleeding. Current vitals? BP 90/50 and dropping. Heart rate 130. He's been receiving transfusions, but they can't keep up with the blood loss. How long since injury? 8 hours. And the environmental conditions. Medical bay temperature is 126 degrees. Smoke has been cleared, but ventilation remains compromised. You'll have functional equipment, but limited backup. Maya nods slowly. Who's the attending surgeon? Lieutenant Marcus Graves. Good physician. Limited trauma experience. He's going to assist me. Understood. The helicopter touches down on the flight deck with a jolt. The side door opens immediately, and humid air floods in, carrying the smell of jet fuel and salt water. A young officer waits outside, standing at attention. Commander Reyes, Admiral, this way please. They follow him across the deck, through watertight doors, down narrow corridors, painted in navy gray. The ship hums around them, alive with machinery and purpose. Maya's feet remember this rhythm. Her body remembers the roll of the deck, the tight spaces, the controlled chaos of a carrier. She does not want to remember. But memory is not optional. They reach the medical bay. The heat hits her before she enters, like stepping into the past. Lieutenant Graves meets them at the entrance. Early 30s, competent eyes, but fear visible in the set of his shoulders. Commander, thank God you're here. We've been keeping him stable, but he's deteriorating. BP just dropped to 80/40. Maya steps past. Tape him into the bay. The heat wraps around her like a living thing. Monitors beep. IV pumps hiss. And on the table, Marcus Webb lies unconscious, pale, dying. She moves to his side, checks his pupils, palpates his abdomen, reviews the monitors with quick, efficient glances. Talk to me, she says. Splenic rupture confirmed by ultrasound. Free fluid in all 4 quadrants. We've transfused 6 units, but he's not stabilizing. Because the spleen is still bleeding. She looks at Graves. We need to take it out, now. Commander, I've never done a splenectomy under these conditions. I have. She meets his eyes. You're going to assist. Do exactly what I say when I say it. Understood? Yes, ma'am. She turns to the surgical tech. I need a laparotomy tray. 4 units of O-negative standing by. Bovie, suction, and extra lap pads. He's going to bleed. A team mobilizes. Maya scrubs at the sink, the hot water adding to the oppressive heat. Sweat already beads on her forehead. She closes her eyes briefly, sees Daniel's face, 22, trusting. Opens them again. This time will be different. It has to be. Maya steps to the table, gloved hands raised, water dripping from her elbows. The surgical tech helps her into a gown that will be soaked with sweat within minutes. The heat presses down like a physical weight. 126 degrees. The air shimmers above the surgical lights. She takes her position at Marcus Webb's right side. Lieutenant Graves stands across from her. Scalpel. The instrument settles into her palm with familiar weight. She pauses for one breath, then makes the incision. Midline laparotomy, clean, decisive, no hesitation. Blood wells immediately. Suction. Graves provides it. His hands are steady despite the heat. Maya extends the incision, dividing tissue layers with practiced efficiency. Skin, subcutaneous fat, fascia. Each layer opens under her blade. Retractor. The surgical tech hands it over. Maya places it, creating exposure. The peritoneal cavity opens, and blood floods the field. Lap pads, multiple. She packs the abdomen, buying time to assess. Her hands move through blood and tissue, feeling what her eyes cannot yet see. There, the spleen, enlarged, ruptured, bleeding actively. I've got the splenic artery, she says. Clamp. Graves hands it to her. She isolates the vessel, applies the clamp. The bleeding slows but does not stop. He's got capsular tears, multiple. We need to mobilize the spleen and take the whole thing. Sweat runs down her face. She blinks it away. Ligating the short gastric vessels first. Suture. Her hands work with mechanical precision. Tie, cut, tie, cut. Each vessel secured before moving to the next. The heat is suffocating. Her mask is soaked, but her hands remain steady. Always steady. She remembers this, the weight of responsibility. The clarity that comes when everything else falls away except the work. Splenic artery and vein, double ligate both. Graves assists, his movements gaining confidence. He is watching a master at work, and he knows it. The spleen comes free. Maya lifts it, a dark mass of destroyed tissue, and hands it off. Irrigate. I want to see if there's any other bleeding. Warm saline floods the abdomen. She inspects every surface. Liver, stomach, diaphragm, intestines. Intestines. There. A small bleeder on the gastric wall. Bovie. The electrocautery hisses. The vessel seals. She continues her inspection. Methodical. Thorough. Nothing missed. Field is dry. Let's close. Her hands fly now, placing sutures with speed that seems impossible. Peritoneum. Fascia. Subcutaneous layers. Each closed in turn. 40 minutes from incision to final skin closure. She steps back, strips off her gloves. Marcus Webb's blood pressure is climbing. 90/60. 100/65, stabilizing. He'll need monitoring for post-op bleeding and infection risk. Without a spleen, he's immunocompromised. Start prophylactic antibiotics, ceftriaxone and metronidazole. Keep him sedated for the next 12 hours. Lieutenant Graves stares at her. Commander, I've never seen anyone work that fast. Speed matters when someone's bleeding out. It wasn't just speed, it was... He struggles for words. Precision. Like you could see through the tissue. I've done this before. She peels off her gown. Beneath it, her scrubs are drenched. You did good work. Solid assist. I barely kept up. You kept up enough. He's alive. She walks to the sink, washes blood from her hands. The water runs red, then pink, then clear. Behind her, Admiral Corver enters the medical bay. He looks at the monitors, at the closed incision, at Maya's face. He's stable? He'll make it. She dries her hands. Barring complications. How do you feel? She considers the question. Tired, hot, but okay. You just saved a man's life, under conditions that would break most surgeons. I did my job. No. Corver steps closer. You did what only you can do. That's not just a job, that's a calling. Maya looks at Marcus Webb, sedated and breathing steadily. 28 years old, twin daughters waiting. I didn't lose him. she says quietly. No, you didn't. She closes her eyes. Relief washes through her, so powerful it nearly buckles her knees. I didn't lose him. Commander Hatch appears in the doorway. The helo's ready when you are. We can have you back in Newark by midnight. Maya opens her eyes, looks at the medical bay, at the equipment, at Lieutenant Graves, who is still staring at her like she performed a miracle. Commander? Hatch prompts. She turns to Corver. You said we'd talk. About my resignation. I did. I want to make a deal. Corver raises an eyebrow. I'm listening. I'll come back, active duty, but on my terms. I want to train the next generation of trauma surgeons, teach them how to work in impossible conditions, make sure they're ready for the worst. You want to be an instructor. I want to make sure no one else has to figure this out alone, the way I did. Corver considers this, then nods. Naval Medical Center, San Diego. We'll create a position, advanced trauma and austere medicine. You'll design the curriculum. And I want one more thing. Name it. 6 scholarships, full ride, medical school. 1 for each. Her voice catches. She pushes through. 1 for each of the people I lost. In their names. Silence fills the medical bay. Done, Corver says. Maya nods. Then I'm in. Grade steps forward. Commander, if you're going to be teaching, I'd like to apply to your program. She looks at him, sees the hunger to learn to be better. You're already in, Lieutenant. You just don't know it yet. He smiles. Maya turns to leave, then stops. Looks back at Marcus Webb one more time. Someone tell his wife, she says. Tell her he's going to meet his daughters. I will, Corver promises. She walks out into the corridor. The ship moves beneath her feet. Familiar, steady. Hatch falls into step beside her. You did good, kid. I did what was necessary. That's the same thing. They climb to the flight deck. The night air is cooler now, a relief after the suffocating heat of the medical bay. The Black Hawk waits, rotors spinning. Maya pauses at the edge of the deck, looks out at the dark ocean. I carried them for so long, she says. I thought if I stopped, I'd forget them. You'll never forget them, Hatch says. But maybe now you can carry them differently. Not as failures, as reasons. She turns to him. Reasons for what? To keep going, to teach others, to make sure their deaths meant something. Maya looks back at the carrier. Somewhere inside, Marcus Webb is alive because she refused to let the past paralyze her. Yeah, she says quietly. Maybe. They board the helicopter. As it lifts into the night, Maya watches the Reagan shrink below. A floating city, full of young sailors who might someday need someone like her. She will be ready. This time, she will make sure others are ready too. The helicopter banks toward shore, toward a future she is finally willing to face. 3 months later, Beth Israel Medical Center in Newark looks different in morning light, brighter somehow. The same worn linoleum, the same fluorescent hum, but something fundamental has shifted. Near the entrance to the emergency department, a new plaque hangs on the wall. Polished brass, simple lettering, the Reyes Protocol, excellence in trauma response. Inside, Dr. Castellanos stands at a whiteboard, teaching 3 residents. His tone is different now. Less arrogant, more thoughtful. Always assess for tension pneumothorax in any trauma with respiratory distress. Always. I don't care what the initial presentation looks like. If you don't look, you won't see. A young resident raises her hand. Even in cardiac arrest? Especially in cardiac arrest. A brilliant surgeon once told me that we miss what we don't look for. She was right. He taps the board. Tracheal deviation. Jugular venous distension. Absent breath sounds. If you see those signs, you act. Immediately. The residents take notes with the kind of attention that speaks of respect earned, not demanded. Across the department, Nurse Linda hangs new training posters. Protocols for mass casualty events. Steps for bilateral decompression. Guidelines written in clear, precise language. Dr. Patel reviews triage procedures with the nursing staff. His voice patient and thorough. The culture has changed. Because one woman refused to accept mediocrity. Because competence became contagious. In the break room, a framed photograph sits on the wall. Maya in civilian clothes, standing with the ED staff. She is not smiling, but her eyes are calm. Beneath it, a small caption. LCDR Maya Reyes, USN. She taught us to see what others miss. Castellano passes the photo on his way to the coffee machine. He stops, studies it for a moment, then continues on. 1 year later, Naval Medical Center San Diego sits under California's sun, sprawling and modern. Inside a lecture hall, 50 young Navy medical officers stand at attention in crisp uniforms. Lieutenant Commander Maya Reyes enters from the side door. She wears service khakis now, ribbons on her chest telling stories most of these students will never fully understand. At ease, they sit with synchronized precision. Maya moves to the front of the room, sets down a tablet, looks across the faces before her, young, eager, some confident, some terrified, all of them about to learn what she had to discover alone. Some of you will deploy to combat zones. Some will serve on carriers or destroyers. Some will end up in field hospitals or forward operating bases. All of you will face situations where the protocols don't cover what's actually happening. She lets that settle, and in those moments, you'll want to freeze. You'll want someone else to make the decision. You'll want perfect conditions and perfect information. She pauses. You won't get them. The room is absolutely silent. You'll get heat and smoke and blood. You'll get equipment that doesn't work, and patients who are dying faster than you can treat them. You'll get impossible choices and insufficient time. She walks along the front row, making eye contact with individual students. That's when you'll discover who you really are. Not in the classroom, not in simulation, but in the moment when everything is falling apart and someone's life depends on what you do next. A young ensign raises her hand. Maya nods. How do you prepare for that, ma'am? You practice until the fundamentals are instinct. You study until you can see patterns others miss. And you decide, right now, that you will not quit, no matter what. She returns to the front, pulls up an image on the screen behind her, a chest X-ray showing bilateral tension pneumothorax. Let's talk about field trauma management, starting with the single most commonly missed diagnosis in austere environments. For the next 2 hours, she teaches. Not from textbooks, but from experience. Every scenario drawn from reality, every technique proven under fire. The students lean forward, absorbing everything. Lieutenant Graves sits in the back row, now enrolled in her advanced program. He takes notes with the intensity of someone who has seen her work and knows the difference between adequate and exceptional. When the lecture ends, a young physician approaches, nervous, determined. Commander Reyes, I wanted to thank you. Your session on hemorrhage control last month, it completely changed how I approach trauma. Maya studies him, sees herself at that age, unprepared for what was coming. She reaches into her pocket, pulls out a pen. Black titanium, pressurized ink cartridge. Take this. He accepts it, surprised. Ma'am, I can't. It writes anywhere, underwater, upside down, in conditions that destroy normal equipment. She meets his eyes. You're going to need it. He nods, understanding this is more than a pen. It is a symbol, a passing of knowledge. Thank you, Commander. He leaves. Maya watches him go, then turns to find Admiral Corver standing in the doorway. How are they? He asks. Getting better. Some of them will be excellent. Because of you. She does not argue. 6 months ago, she would have. Now she simply accepts it. The scholarships are fully funded, Corver says. First recipients start next fall. The families wanted to thank you personally. Maya's throat tightens. That's not necessary. They disagree. Daniel Okonkwo's mother specifically asked to meet you. She closes her eyes briefly. Okay. Corver hands her a folder. Also, this came through. Marcus Wedd's wife. She wanted you to have it. Naya opens the folder. Inside, a photograph. Marcus Wedd in civilian clothes, holding 2 infants, smiling, alive. Below it, a handwritten note. Commander Reyes, you gave my husband back to us. Sarah and Emma will grow up knowing their father because of you. We can never repay that, but we will never forget. Thank you, Amanda Webb. Maya stares at the photo for a long moment, then carefully places it in her bag. You good? Corver asks quietly. Yeah, I'm good. That evening. Maya sits alone in her office. The sun sets over San Diego, painting the sky in shades of orange and gold. On the wall, 6 photographs hang in simple frames. Petty Officer 2nd Class Daniel Okonkwo, 22, Houston, wanted to be a teacher. Lieutenant Maria Vasquez, 31, San Diego, mother of 1. Ensign Tariq Williams, 24, Chicago, engaged to be married. Seaman First Class Grace Lewiston, 19, Portland, artist. Petty Officer Jake Rennick, 27, Nashville. Musician, Chief Warrant Officer Samuel Cho, 38, San Francisco. Made terrible coffee. She looks at their faces. Every single night she looks. And every morning, she gets up and teaches someone else how to save the next one. Her phone buzzes. A text from Lieutenant Graves. Ma'am, that pen you gave Ensign Morris? He used it today to document a field procedure during training. Said it gave him confidence. Just thought you should know. Maya smiles slightly, types back. Good. That's what it's for. She sets the phone down, looks at the photos one more time. I'm still trying, she says quietly to the empty room. Every day, I'm still trying. The faces look back at her, silent, understanding. Outside, the sun finishes setting. Darkness rises over the Pacific. But inside, lights burn bright. In lecture halls and training rooms and hospital bays, a new generation learns what Maya learned the hard way. That competence is built in repetition. That excellence demands sacrifice. That the difference between life and death is often nothing more than one person who refuses to quit. Maya stands, gathers her materials. Tomorrow she teaches again, and the day after that, and the day after that. Because this is who she is. Not despite the sick she lost, but because of them. They are her reasons, her fuel, her reminder that every life matters, every moment counts. Every skill honed is another chance to tip the balance toward survival. She walks out of her office, locks the door, heads toward the parking lot. Behind her, the photographs remain, watching over an empty room that will fill again tomorrow, with students who do not yet know how much they will need what she has to teach. But they will learn. She will make sure of it. Because Lieutenant Commander Maya Reyes, United States Navy, does not quit. She never has, and she never will. The end.